Hello everybody, it's Dr. Amar Romanovic from German Heart Center here in Dubai. Today's topic is diabetes, and first of all, here are some key facts. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Prevalence has been rising rapidly in low and middle income countries. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In 2019, diabetes was the 9th leading cause of death, with an estimated 1.5 million deaths directly caused by diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, and regular screening and treatment for complications. What is diabetes? Diabetes happens when your body isn't able to take up sugar into its cells and use it for energy. This results in a build-up of extra sugar in your bloodstream. Diabetes, also called diabetes mellitus, is a condition that causes blood sugar to rise. Poorly controlled diabetes can lead to serious consequences, causing damage to a wide range of your body's organs and tissues, including your heart, kidneys, eyes, and nerves. Why is my blood glucose level high, and how does this happen? The process of digestion includes breaking down the food you eat into various different nutrition sources. When you eat carbohydrates, your body breaks this down into sugar, into glucose. Glucose, a sugar, is a main source of energy for the cells. When glucose is in your bloodstream, it needs help. It needs a key to get into its final destination where it's used, which is inside your body cells. This help or key is insulin. Insulin is a hormone made by your pancreas, an organ located behind your stomach. Your pancreas releases insulin into your bloodstream. Insulin acts as the key that unlocks the cell wall, which allows glucose to enter your body cells. Glucose provides the fuel or energy tissues and organs need to properly function. If you have diabetes, your pancreas doesn't make any insulin or enough insulin, or your pancreas makes insulin but your body cells don't respond to it and can't use it as it normally should. If glucose can't get into your body's cells, it stays in your bloodstream and your blood glucose level rises. What are the different types of diabetes? Type 1 and type 2 diabetes. In type 1 diabetes, the pancreas doesn't make insulin or makes very little insulin. This type is an autoimmune disease, meaning your body attacks itself. In this case, the insulin-producing cells in your pancreas are destroyed. Up to 10% of people who have diabetes have type 1. It is usually diagnosed in children and young adults, but can develop at any age. It was once better known as juvenile diabetes. People with type 1 diabetes need to take insulin every day. This is why it's also called insulin-dependent diabetes. Type 2 diabetes. In type 2 diabetes, there are two interrelated problems at work. Your pancreas doesn't produce enough insulin and cells respond poorly to insulin and take in less sugar. Type 2 diabetes used to be known as adult onset diabetes, but both type 1 and type 2 diabetes can begin during childhood and adulthood. Type 2 is more common in older adults, but the increase in the number of children with obesity has led to more cases of type 2 diabetes in younger people. In type 2 diabetes, the body stops responding to insulin normally. Cells in muscle, fat, and the liver become resistant to insulin. Because these cells don't interact in a normal way with insulin, they don't take in enough sugar. Then, over time, the pancreas stops making enough insulin. Exactly why this happens is unknown, but being overweight and inactive are key factors. Pre-diabetes. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Gestational diabetes, this type develops in some women during their pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you are at higher risk of developing type 2 diabetes later on in life. Symptoms, there are three big symptoms, 3 P's. First P for polyuria, frequent urination. The body actually tries to urinate it out. Polydipsia is a lot of drinking fluid. The body tries to delete all the sugar. And now the third is polyphagia, which is increased hunger as cells starve since insulin is not doing its job to get sugar inside the cells. Signs and symptoms of type 2 diabetes often develop slowly. In fact, you can be living with type 2 diabetes for years and not know it. When signs and symptoms are present, they may include also weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet. In part 2 of this topic, I'm going to speak more about complications, treatment and prevention of diabetes. Thank you so much for listening. Please help me tell others about this channel by reviewing, rating or subscribing. And please share it on your social media. Enough for now. Have a lovely day. Speak to you again soon. Goodbye.